You are called to the operating room. What questions you must find out before the delivery? Before the delivery, we need to know 4 things. What is the gestational age of a baby? Is amniotic fluid is clean? How many babies are expected to be born? Are there any risk factors? Gestational age 39 weeks. Amniotic fluid is clean. 1 fetus. Umbilical loops drop. Cesarean section. We need to check resuscitation equipment availability. It is necessary to turn on a radiant heat source in advance. Prepare warm sterile diapers, a shoulder roller, suction supplies, a rubber pier. The device for artificial ventilation is a resuscitation bag with face masks, laryngoscope with a set of endotracheal tubes, sterile gloves, a set for catheterization of the umbilical vein, which means antiseptic, cotton wool, scalpel, umbilical catheter, and syringes. And also medicines are needed, physiological solution and adrenal solution, neonatal stethoscope, pulse oximeter, and baby clothes. Full-term baby just born with no crying and no spontaneous physical activity. What kind of initial assistance should be provided for the baby? Initial help should be provided in 30 seconds. We put the baby under the source of radiant heat, place the shoulder roller under the shoulders so the head is in the mode of moderate extension. Using the rubber pier, aspirate the contents of the oral cavity, sinking in not deeper than 3 centimeters. Alternately, aspirate the contents of both nasal passages. Aspiration should not take more than 5 seconds. Then we dry the baby. We take away a wet diaper and wear a hat. Make an additional tactile stimulation, rubbing the skin on the back and limbs. We check the baby's condition. After the initial care, the baby doesn't breathe. The heart rate is 70 per minute. The skin is cyanotic. What kind of resuscitation care should be provided for the baby? The next stage is lung ventilation under positive pressure for 30 seconds. We connect the appropriate size face mask to the ambu bag. Apply it to the baby's face so it covers the chin, mouth, and nose. And perform mechanical ventilation under positive pressure for 30 seconds with a frequency of 40 or 60 breaths per minute, watching the chest excursion. After 30 seconds, we check the baby's condition. After 30 seconds of ventilation under positive pressure, the child doesn't breathe. The heart rate is 50 per minute. What actions are needed in this case? We fasten a pulse oximeter to the baby's right hand and check the oxygen saturation. The next stage, tracheal intubation, mechanical ventilation, and indirect cardiac massage for 60 seconds. Using a laryngoscope, we insert an appropriate size endotracheal tube into the trachea. We connect the resuscitation bag, and then we continue the artificial ventilation through the resuscitation tube. At the same time, we do an indirect cardiac massage. We place our thumbs on the lower half of the sternum, avoiding the xiphoid process, intra-nipple line. The rest of our fingers are placed under the baby's back. The depth of the sternum traction is 1/3 of the chest. Coordination of compression before ventilation is 3-to-1 every 2 seconds. After 60 seconds, we check the baby's condition. After 60 seconds of ventilation and indirect cardiac massage, there is no spontaneous breathing, the heart rate is 50 per minute, the skin is cyanotic, the saturation is 65. The next stage is the catheterization of the umbilical vein and an adrenaline solution injection. Change sterile gloves. Then moisture the umbilical cord with an antiseptic solution. Impose a ligature on the base of the umbilical cord. Intersect the umbilical cord with the scalpel 1-2 centimeters above the umbilical ring. Then find the umbilical vein and inject a catheter 3-4 centimeters depth. Fill up a syringe with a solution of adrenaline. Check the free flow of blood, pulling the syringe piston towards you. When the blood appeared in the syringe, introduce the solution of adrenaline in a dilution of 100%, 0.1-0.3 milliliters per kilogram per body weight. For example, baby weighs 3 kilos. Inject 0.9 milliliters of adrenaline solution. Check the baby's condition. After adrenaline injection, the heart rate is 110 per minute. The level of saturation is 90%. Your actions. Continue the mechanical ventilation through the endotracheal tube and transfer the baby to the neonatal intensive care unit to provide post-resuscitation care.